Welcome to OET Answers.
Let's start our discussion. So, read the questions. When dealing with patients following a safety incident, staff must avoid which of the following measures does not constitute palliative care? Which of the following is not attributed to the lack of socialization? And the last one, in addressing patients after a safety incident, staff should refrain from. You might have dealt with these type of questions, right? So whenever you're practicing or whenever you had your OET examination, definitely in the part B, you might have seen about the questions. Clear? All right. So it is the trickiest type of questions. So in this video, I'm going to explain what type of question is. So please watch the entire video, and I assure you, at the end of this video, you will get a best idea. Moreover, you can apply the strategy for this kind of question, right? So let's start. First, you need to understand what is NFQ. NFQ indicates negative factual questions. All right. So identify the information that is not stated in the given text. And it begin with the phrases like not, except, not true, avoid, exclusion, incorrect, does not, likewise. The negative factual question in test your ability to identify information that is not true according to the passage. Okay, it is negative aspect in the sense it's not true or it's not given in the text that you need to choose. So for your understanding, I would like to give you an instance. So under the passage, what they have mentioned, the patient presented with a history of severe abdominal pain and vomiting. This is your scenario or the passage, right? And now look at the question. According to the passage, which of the following symptoms did the patient not experience? What type of question? Here we have been dealing exactly. We have been dealing with the negative factual questions, which means it's completely not true according to the passage, or else the information is not stated in the given text. So in your question, the patient not experience, which means the patient has no symptom of what? That you need to choose, right? So in your question or the passage, they have already mentioned abdominal pain and vomiting. So vomiting is the symptom already patient had. In your question, what they have asked, not experience. Not experience means patient has no symptom. So you can eliminate vomiting, right? All right. Then about diarrhea and nausea. Okay, diarrhea and nausea, they have given. These are the other two options. Okay. So diarrhea is a completely contradict information because no related information has been given in the past. But the nausea, which is related to vomiting, right? Do you agree with me? Yes. So nausea, first nausea occur, then the vomiting will be there, right? So nausea is related to vomiting. But while comparing nausea and diarrhea is completely contradict. It's doesn't even suitable with the vomiting or abdominal pain. Okay, that's the reason we can eliminate option A, that is nausea also. Okay. And finally, we have only one option, that is diarrhea. So the diarrhea only, that symptom only, patient not experience. So for question, according to the passage, which of the following symptoms did the patient not experience? Not experience means not even given in the text. That you need to choose. So your answer as B. So for the reason I have mentioned, so that's the reason we are choosing option B as the right one. All right. I hope the example really make you understand. From my side, I taught you now, but for me, you have to do a favor. So try to solve that task. Okay, this is for your passage already. They have given the patient condition improved significantly after the medication was administered. Their question was, which of the following is not possible side effect of the medication. So you have to understand about the key point. Which of the following not possible? Not possible in the sense either they have not mentioned here or else it's completely beyond the information, right? That you need to understand, right? So four options they have given: headache, dizziness, insomnia, and weight gain. So once again, read the question carefully. Your focus would be finding the right answer for appropriate question, right? So what's your question? Which of the following is not possible side effect of medication? Okay, so below mentioned the four symptoms. One of the symptoms is not suitable for the side effect of medication. What would be? All right, headache. So you might have learned previously or during your college days, headache, dizziness, insomnia. That might be a symptom of medication. So whenever you're handling with the drug note, definitely you might have passed over, right? But about the weight gain, if they have given any therapy like a hormonal therapy, some symptoms will improve regarding weight changes. But other things about the side effects, only they have mentioned about side effects of medication. So headache, dizziness, insomnia would come under the side effects, but not possible in the sense weight gain. Okay, so weight gain should not come as a side effects of medication. So in your passage, what they have mentioned, the patient condition improved significantly after the medication was administered. Okay, so what are the side effects that you need to choose related to medication, but which one is not related to the medication administration that you need to choose? So for question number 2, that is your task. You are choosing last option, weight gain, as the right one. All right, we go with our actual performance. Now, read the question carefully. When dealing with patients following a safety incident, staff must avoid. Now, get into the passage. The title is Patient Safety Incidents. Information about a patient safety incident must be given to patients and or their carers in a truthful and open manner by an appropriately nominated person. Okay, so which means we have to share or declare the information about the patient safety incident. So we have to declare the information to patients as well as their relatives in a truthful and open manner. Okay, so open hearted or straightforwardly, we have to explain with the appropriately nominated person. Okay, so patients want a step by step explanation of what happened that considers their individual needs and is delivered openly. Okay, so whenever we are providing care to the patient or whenever we are going to provide a care to the patients, we have to give the entire explanation what we are going to perform for the patient and what is the purpose of it. Everything we need to deliver properly, right? Then communication must also be timely, which means on time. Whatever information you're getting, you have to convey in a positive way, politely, in a firm manner, you have to convey. So communication must be on timely. Patients or carers should be provided with the information about what happened as soon as practicable. Okay. So whatever happened previously or what is going to happen, everything we have to declare the information on time. It is also essential that any information given is based solely on the facts known at the time. Okay, so which means any information is given based solely. Solely means individually on the facts known at the time. Healthcare staff should explain that new information may emerge as an incident investigation is undertaken. So, healthcare staff also should explain about the new information appears at that time. And patients and their carers will be kept up to date. Everything we have to update with the patients and their relatives regarding their progress and of an investigation. The duty candor regulations require that information be given as soon as is reasonably practicable and be given in writing no later than 10 days after the incident was reported through the local system. The on-time communication must be there. We should not give any late information. Okay, so this is about the patient safety incidents. I hope you might have understand. It's really given in a simplistic language, right? Staff must avoid in the sense this is the NFQ type of questions. What the staff must avoid. So under the three options, definitely she must avoid only one thing, and another two things will be included in the content, right? So we know very well about the definition, right? So let's first start. Staff must avoid saying anything until the facts have been established, which means staff should not reveal anything. So once the facts have been established, she should not say anything like they have mentioned. Okay. So if you see in the passage, they have mentioned communication must be timely, right? So I highlighted now. Communication must be timely and carers should be provided with the information about what happened as soon as practical, which means we suppose do not deliver the information lately, as well as we have to convey all information on time. Staff must avoid saying anything until facts have been established, which means, so you know very well, tomorrow or day after tomorrow, the truth will be declared until we can say anything like they have mentioned. So which means staff must avoid saying anything until the facts has have been established. Okay, so we supposed to not say anything until the facts have been established. This direct contradictory information which has been mentioned in the passage. Okay, so when following an incident, we have to select the most appropriate one. So you can keep as a query. Let's we deal with it later. Then look at the second answer option, speculating on possible causes of the incident. Speculating is nothing but just explaining about the possible causes of incident. So in the answer passage, did they given any information about the possible causes of incident? No, not really. Patient safety incidents and how the communication would be and what are the things we have to run. So that things only they have mentioned. So B option is completely wrong. So you know very well, this is not the information given in the answer passage. So you can eliminate. And about option A and C, let's be correlate with it. Now look at answer option C. Contradict. Staff must avoid contradicting what has been said by other staff. Staff must avoid. Contradict means opposite. Okay, so opposite means, so if I was a morning nurse, I have conveyed one information to my patient regarding his blood test results, right? So the afternoon nurse will come and she will be explained about the negative results of the blood test. So what will happen? Misunderstanding or misleading will happen. So in order to prevent that, what you have to do is we have to avoid contradicting information. So we suppose do not do like that. Whatever the doctor or nurses, whoever conveys the information, everything would be on a same basis, not in a different way. Okay, or not in the opposite aspect, right? So staff must avoid contradicting what has been said by other staff. Okay, so I said morning was a positive blood test result. So the next nurse, she is going to convey that opposite information that we need to avoid. Okay, so here the avoid in the sense the staff must avoid contradicting what has been said by other staff. Right. So this is the exact answer they have given. And let's be correlated with the answer option A, saying anything until the facts have been established. So staff must avoid saying anything until the fact have been established, which means we're supposed to not say anything until the fact has been established. So actually what they have mentioned is it is also essential that any information given is based solely on the facts known at the time. So whatever you know, so at the time you have to, at the time, right? So you have to establish. So this is the opposite information. Okay, so this is not the information they have given in the passage. So you can eliminate answer option A. So B is completely beyond the information. A is little bit wrong information, and the C is the exact one they have mentioned. So staff must avoid contradicting what has been said by other staff. All right. So I hope you got the point, right? So now we can correlate with the definition and with the actual performance. So what was the definition? You are supposed to identify information that is not stated in the given text. These questions often begin with the phrases like note except which of the following is not true. Staff must avoid exclusion does. Okay, so initially the information that is not stated in the given text, that is not stated in the given text. So which means the option C is not stated in the given passage, that is patient safety incidents, right? But we can choose staff must avoid means that thing only we have to avoid. Other things we can eliminate it. Clear? So now just we can move on to the methods. Okay, so we can consider this as a pathway. Okay, if you follow the pathway, you can perfectly do the strategy without any errors, right? So first, your first point is read the question carefully. Okay, read the question carefully. So you have to give your special attention to read the question. Then your second task is mark keywords in the question. Okay, so try to make or mark keywords in your question like not, never, except, in addition, is such as incorrect, not true, avoid, refuse, restrict, like that. Completely negative things. And the point three is read and understand the passage. Okay. So first you read the question and you mark the keyword. And third one is you have to read and understand the passage. Okay, you have to read as well as the same time you have to understand the passage. You can imagine like a story or imagine like a order, right? That final one, eliminate. Okay, so you know very well negative factual question, right? So which means you can eliminate the positive statements. You are going to choose the negative one, so that's the reason you can eliminate a positive statement. So I hope hereafter you can handle the NFQ questions very easily with your part B, especially in NFQ time, right? So I hope this session is really beneficial for you. If you need any further assistance with your OET, we will provide you 100% quality training and we will provide you a special attention individually. One-to-one discussion sessions also available. Individually, we are dealing with each modules. For more details, please contact OET Answers.